When you look at how nursing has really been at the forefront trying to deal with COVID-19, how will it impact nursing financially?
Well, that's a very good question, Francine. We have never seen anything like COVID-19. And so hospitals have never seen an impact like this. Frontline nurses are in a fairly solid position. It's the nursing piece around the front line that is subject to review. And that's as in any financial market situation. This is similar to I was in the hotel business. We saw this in 2001 with 9/11, where the volume dropped completely and different decisions had to be made. But I do think that nursing is in an excellent position to rebound in any way because we have a lot of professional agility.
Mm-hmm. Do nurses across the country feel like they've been taken care of, both from a physical but also mental point of view?
I can speak for Johns Hopkins, and I know that we are reaching out to all of our employees and encouraging them to take advantage of the many support systems that we have here at Johns Hopkins. And I do know that other institutions are doing that as well. And I think this is one of the first times that I've seen this big push to say to people, we don't know how we're supposed to feel, so we need to develop some different resiliency and emotional agility skills.
I know we talk about blended roles, so nurses actually having slightly different roles or going and moving from one department to the next. How do you think COVID-19 will actually change the nursing world forever?
I think the blended model is going to be here for quite a while. I know that we at Johns Hopkins are looking at that very seriously, that we're training a nurse who used to work on a general ward to elevate her skills to an IMC level, intermediate care, and the same with an intermediate care nurse to develop those skills that are needed at the ICU. I will tell you COVID was a big wake-up call about how limited we are in the valuable ICU nursing resource.
What do we still not understand about the virus? I'm reading various reports that, for example, 30% of those who have recovered from coronavirus could have long-lasting effects on their lungs. How much do we know about the secondary effects of this disease?
Well, we're learning a little more every day, but you're absolutely right, Francine. The impact on the lungs, the impact on the long-term physical condition for patients is really our next step. One of our inpatient medicine units has converted into a mini rehab facility where we can start that rehabilitation for patients before they're even discharged from the hospital, because we've recognized that this is a long, long recovery process for some patients.